I am verifying my physician's orders to do an open manual irrigation of this patient. Purpose for it is to get patency back into the catheter again, and also to administer solutions or any medication. I would then gather my equipment. I would need my sterile syringe. I need my chuck. I would need alcohol wipe, and I need some sterile saline. I would then wash my hands and put on my gloves. I would introduce myself to the patient, a normal standard brief. I would get his name and date of birth to verify that he is in fact my patient. I would then, after seeing that it's the right patient, I would then create a clean surface by taking disinfectant wipes and cleaning it twice and letting it air dry. Once it's dry, I can then, with no touch technique, open my my sterile basin and syringe. I would then place it on my clean surface, and I would then expose my patient, trying to keep as much privacy as possible. I would then take my waterproof pad or my check and place it underneath him. And then I would then place my basin right up to the very end, trying to keep a sterile environment. I would then want to take my syringe, take the cap from it so that I can create a sterile fill between the Christmas tree. Take that there. And I would take my alcohol wipe or an iodine, and I would clean around the ring with friction for 15 to 20 seconds. When that's clean, I would pinch and remove the catheter from the Christmas tree, and then since this is sterile, we want to keep it sterile, and we'll attach it to the cap of the syringe so that it stays sterile. And we can place it on top of our patient or wherever it would stay clean. The cap doesn't really stay on, and I would let the catheter empty out into the basin. I would note if it's patent right now, or see if there's any color, odor, clots that are coming out. I would then take my sterile saline. I would open it up, and I would pour it into my sterile container. Once it's in there, I would then cap it and then hold up 30 mL. And if there wasn't anything coming out, I want to aspirate to try to remove the clot. If not, I would then try to start instilling the 30 mL, try to keep it a sterile procedure or sterile environment. So I would pulsate some water in there, all 30 mL, pinch it, let it drain out, and I would do that as many times as I would need until it's completely clear. I would notice and record the color of the urine, if there's any sediment, any coagulated blood, any sort of debris, and then again just document the odor, odor and color of the urine. After it's completely patent, I would then take my Christmas tree that still had the cap on it, and again take it off where it's sterile and reattach